Hello, it's Dr. Rhonda Johnson. Today is Monday, May 16th, 2022. And today I'm talking about COVID cases in kids and in schools. But first, I want to pause to remember all the victims of the senseless gun violence in the United States. We're in the midst of many pandemics, and we're certainly in an epidemic of gun violence. But today I'm talking about COVID cases, so I'm going to share some headlines that you probably have already heard. That new COVID cases in Massachusetts schools have risen by 62.6% last week, and now some Massachusetts school districts are asking kids to wear masks on a voluntary basis. Now in the Pittsburgh, Pennsylvania area, 2 local school districts have re-implemented mask requirements amid rising COVID cases. Less than 2 weeks after making masks optional, the Pittsburgh Public School District had to bring back its mask mandate. And another school district, Woodland Hills School District, which had ended its universal indoor mask requirement in March, the students now will have to wear facial coverings for the next 10 days. In another state, Northern Virginia, outbreaks in schools, primarily elementary grades, have increased rapidly. In the last 2 weeks, there were 213 classrooms in Northern Virginia that reported outbreaks of COVID in both public and private schools, as well as child care facilities. And in California, year-end celebrations such as proms have become hotspots for COVID transmissions. In some school districts, at least 2 proms saw a big increase in students testing positive after the prom. So why the rise? Well, these increases are likely due to the Omicron subvariants BA2 and BA2.12.1. That is a mouthful. And the fact that people aren't using mitigation measures such as masking or distancing. Now, I have to do a little bit of refresh. Remember Omicron BA1? It was 30% more contagious than Delta, then became BA2, which was 1.5 times more contagious than the original BA1 Omicron variant. Well, CDC reported last week that 43% of U.S. cases were the BA2.12.1 variant. Now, this is going to become the dominant Omicron subvariant, and it's 25% more contagious than BA2. Things are not looking good for American children and COVID. The CDC says that 75% of children have already been infected with COVID. Now, I know that kids most of the time don't get seriously ill, but remember, parents, get your kids tested if they have signs of COVID. And we have to remember that during the peak of Omicron, original wave, COVID hospitalizations among children ages 4 and under was 5 times as high as compared to the Delta wave. And more kids are showing signs of long COVID. So let's get back to remembering primary prevention. Mask back on indoors, do more activities outside, open the windows when possible, wash the hands, and know the signs and symptoms of COVID infection. That's my message today. As always, my views are my own. Stay safe and have a safe week.